When you control your blood sugar, you protect your sight and your safety. Good afternoon, dear listeners, and welcome to Eyes on the Road. Of course, this is your go to show for expert eye health insights, proudly brought to you by Lagos Traffic Radio 96.1 FM. All right, we're still in the month for diabetes awareness. Yes, the entire month of November will be all about diabetes awareness. And today we're placing our focus on one of the silent yet very serious complications of diabetes that affects millions worldwide. I'm talking about diabetic cataract. Yes, you heard me correctly. Diabetic cataracts. You know, the cataracts, yes, we have cataracts and we have diabetic cataracts. Of course, as we continue our Ember Month sensitization campaign on good eyesight and road safety, today's episode will help you understand how high blood sugar, can cloud your vision, how it can increase driving risks, and, how proper management can restore clarity and confidence on the road. My name is Akan Usen, and of course, here with us on the show today is our in-house doctor, yes, talking about none other than Dr. Priscilla Imade, here ready to give expert insights on today's topic. All right, welcome, Doctor. Great to have you with us on the show.
Thank you very much, Akane. A happy afternoon to you and to our dear listeners. I'm very excited. I'm happy to be here. It's my pleasure to talk to everybody about the eyes.
Yes. Today has been quite sunny. Does it have any...
sunny, and there was traffic.
Traffic, okay.
From my Aziz, from Beggar Aziz.
Oh dear. Sorry.
Thank you.
Okay. So for those who missed last week's edition on diabetes and the eyes, could we have like a quick recap to lay a foundation as we delve into today's topic?
Yeah, thank you very much, Akan. The month of November is actually internationally set aside to create awareness about diabetes and its effects on the eyes. Specifically, next week we are going to be agog with diabetic retinopathy, which is actually one of the leading causes of irreversible blindness as well, apart from maybe glaucoma. So last week we introduced the topic and we had a guest, Barrister Amaka, who actually, joined us in the discussion on
she did justice.
How diabetes affects the eyes. And we said there are several ways diabetes can affect the eye. So diabetes can make one's vision cloudy. It can make you start changing your glasses unnecessarily, and there could be itching, quite a number of symptoms. And if you don't attend to these symptoms, blindness can actually occur. Coincidentally, do you know this month, in fact this week, I've had several cases of diabetic cataract.
Wow.
Honestly. And today we are going to talk about diabetic cataract. For some of the patients I've seen, in fact, there was a woman that came. She just came in, very psychedelic woman, looking nice, looking good.
Okay.
And she said she wanted to travel out and she needed glasses. Going abroad, glasses can be very expensive.
Okay.
So she just needed a pair of glasses that she can take along with her. Lo and behold, we examined her and discovered that there were changes in her fundus. For somebody that have diabetes.
Okay, please come to our level.
Okay, when you come to Modern Eye Clinic, for example, we don't just only test you for glasses, because the test for glasses is just like 1/10% of the eyes. So we take our time to look through your general eye health and analyze every structure in the eye. If there is going to be any problem that will affect you in another 2 years, 5 years, 10 years, we can readily detect it and, warn you on how you can properly take care of your eyes to prevent that visual impairment from occurring. So when we examined this lady, we just discovered that there were changes in her fundus. We checked the lens as well. There were already changes on the lens. So we told her to go and do a HbA1c test. Fortunately, we have a laboratory in our building where blood tests are being conducted. Okay. So she went upstairs, did the HbA1c test, and lo and behold, it was well above normal.
Okay.
Funny enough, she said when she came in,
and she had no sign.
She said, "Oh, my blood pressure is okay, my blood sugar is okay, everything is okay." So some people may not even know when their blood sugar is high, except when it is way high. Some people, they are able to overcome their symptoms. They ignore the symptom, thinking that it's just a normal everyday, occurrence. not knowing that there are changes already happening in the body as well as affecting the eyes. In fact, studies have even shown that people who are diabetic, sometimes it takes as much as 5 years before they will know that they actually have diabetes.
Right.
So today we are going to talk about diabetic cataract. Diabetic cataract is the clouding or opacity of the crystalline lens in the eye. There's a natural lens in the eye that God has put there. It's actually that scientists look at to create this lens that we put in glasses to make people see.
Okay.
So when that natural lens is supposed to be clear to make you see, just like glass, the front of the windshield of your car.
Yes.
At all times supposed to be clear. So that's how the lens in the eye is supposed to be. So if it is not clear, maybe there is dust, there is anything that can reduce, the clarity.
Yes.
Resulting in what we call cloudiness or opacity. That's actually what we call cataract.
Okay.
Cataract simply means that natural lens in the eye, or that windshield through which you look out of your car, is dirty, or there's oil on it, or there's sugar on it, is no longer clear, is cloudy. That's actually what cataract means.
So, but in this case, it's not oily, or it's not.
Yes, in the case of cataract, it can be oily. There are some, there are some proteins. Protein is fatty deposits, oily deposits from proteins and all that. They can actually accumulate on the lens and make it worse. But in the case of diabetic cataract, it's sugar.
Okay.
So when the lens absorbs excess sugar, it loses its transparency. And when that happens, we call it diabetic cataract.
Okay.
So it is only people who have diabetes that can have what we call diabetic cataract.
Okay.
There are other forms of cataract too. Because this month we are discussing diabetes.
That's why we're talking,
and the effects of diabetes on the eye.
this.
Yes, that's why we are talking about diabetic cataract. And it can occur earlier or progress faster in any diabetic patient. And it's usually in the two eyes. Diabetic cataract cannot happen in one eye. It will always happen in both eyes at a time. But the degree can be different.
Okay.
So it can affect vision in different ways. So that's why we always encourage people to have their eyes tested. Looking at global statistics, we have said before now, cataract is the leading cause of blindness worldwide. And there are different things that can cause cataract.
Okay.
We are just dwelling on diabetic cataract today. So about 51% of blindness in the world is caused by cataract, and diabetic patients are 2 to 5 times more to likely develop cataract than people who don't have diabetes. You see why it's important to always check your sugar levels, especially when you are over the age of 40.
True.
And the duration, how long the diabetes has stayed within you, they've managed it, is still the greatest risk factor. The longer the period of the diabetes in the body, the more prone you are to developing diabetic cataract or diabetic retinopathy, or even diabetic changes in the eye. So make sure that as you are managing your blood sugar level, you are also going for regular eye examination. Age is a major factor, like I've said, and some of the symptoms.
When you say age, does that mean after a certain age? I don't know.
For people 40 and above, 50 and above, 60 and above, the higher in age, the more you are prone to many of these systemic diseases like hypertension, diabetes, and all that.
Okay.
Yes. So for the symptoms, how do you know if you are diabetic and you are developing diabetic cataract? There can be a gradual blurring of vision or cloudy vision. And then you start seeing glare around light. Maybe in your room, you are looking at the bulb.
It looks like a rainbow or something.
It can look like there's a rainbow around that light.
Okay. I think someone has, someone has given us that kind of complaint on the show.
Yes. Someone called in. Yes, exactly.
Like it was seeing light, but it was seeing like cloudy, rainbow,
Even for drivers too, you see glare. Oncoming vehicles, instead of maybe seeing the light as straight lights, you see scattering, and then you see a rainbow around it.
So please, beyond diabetes, if someone who has that kind of symptom or notices such, should that kind of person be worried?
Yes, you should be worried. It's not normal.
Okay.
Please be worried. If you are notice anything, any image. Sometimes people say, oh, we see like shadow around the lights or around images we are looking at. You should be worried because contrast sensitivity becomes also very high, fading of colors, and then yellowing of vision, frequent changes in spectacle prescription. I also had a patient this month who just did her glasses. Within a year, the glasses changed and she came. She didn't do that first glasses with me. She came, she said, she just did her glasses. She's no longer seeing with it. And we checked. Say, oh, go and do your HbA1c. And she said, no, nothing is wrong. When we checked to discover that, she is already diabetic and she didn't know. We also had a case of that even yesterday, Someone had to change their glasses as well because they didn't know they were diabetic. So frequent changes in spectacle prescription without diabetes, if you do your glasses, especially for reading, should be able to last you for like 2 years or even 3 years as the case may be. But after 2 years, yes, naturally you can notice changes. But for people who are diabetic, within 6 months, 1 year will be just managed. They will be seeing changes, in it. So it's good that once always check your medical status, check your sugar level.
Okay.
Some of the risk factors we have found that is that there is poor control of blood sugar. That's actually the highest risk factor. People that not even know that they are diabetic, they don't control it very well. And when that happens, it's actually going to, affect the eyes. Poorly controlled. I have a patient that told me, say, doctor, I only take my medication when I feel it. When I feel that it is high, or when I'm no longer feeling okay.
Well, I know somebody that does that for her blood pressure
they do
medication.
They do it for sugar too. One said, no, I don't want to get used to the medication, so I only just take it, when I want to. So these are poor control because you don't know and you are not monitoring. It can be very high and something can happen.
All right, can we quickly take this update? We have this one from the Ogolonto axis. An overspeeding 20 feet loaded container fell on its side at Asolo in Words, Lagos. It's occupying about 50% of the road, and the police at Owode police station have been contacted. It's affecting traffic, but nothing to worry about. We have traffic managers, doing their bit to manage things. An overspeeding 20 feet loaded container fell on its side at Asolo in West Lagos and is occupying almost 50% of the road. The police at Owode police station have been reached out to. It's affecting traffic slightly, but no cause for alarm. Around the Ikponri end, we have this update of installation of solar panels by men of Light Up Lagos on Domalong Bridge in West Fadeyi, and this has resulted in a backlog of traffic all the way to the Abati barracks. Meanwhile, we have traffic managers on ground, trying to manage the traffic situation on that end. On the show, Dr. Priscilla has been talking about diabetic cataract, yes. And if you want to join in a conversation, feel free to connect with us. We definitely would love to hear from you. 080-991-20-777. Do not say, oh, I don't have diabetes, so this should not even concern me. It's only for those who perhaps might be suffering from that condition. But I feel that is a wrong point of stand to take. If you have any eye questions or concerns, even beyond diabetic cataract, even beyond diabetes, feel free to connect with us. 080-991-20-777. Now, that's also our WhatsApp line, 080-991-20-777. You can also call 090-538-77127. All right, back to you, Doctor.
Yeah, thank you very much, Akan. So we're looking at risk factors for developing diabetic cataract.
Okay.
We have said that it's only people that have diabetes that
of course,
develop diabetic
And I was
cataract.
saying some few people might not even want to, talk about this because maybe they feel they don't. Of course, they don't have diabetes, so why should they, be part of this conversation?
Everybody's at risk of diabetes because of our diet, and as you are aging too, 40 years and above.
Okay.
Even when you don't have it in the family. So it's also good for you to get educated, ask questions. At least cataract, anybody can develop cataract.
Okay.
Know whether your cataract is diabetic or not.
Okay.
So it's good for us to know. At least you may know someone around you too that you can help educate on the health of their eyes. So don't say because you are not diabetic, you can't call in or you can't listen to the show. The talk show is for everybody.
Okay.
So risk factors: poorly controlled diabetes, and then the longer the duration of diabetes, the more at risk.
Okay.
Obesity, sedentary lifestyle, smoking, alcohol, ultraviolet light exposure, genetic factors, and the use of steroidal drugs, they are also implicated. Let's look at the effect of diabetic cataract on driving.
Okay.
Can you imagine how that would be if a driver that is diabetic and now is developing cataract is driving from here to Kano in the night?
All that.
So the effect of driving on driving, number one, I have a blurry vision.
Okay.
Somebody that have diabetes, so uncontrolled diabetes, poorly managed diabetes, and the person is developing diabetic cataract, is going to sure have blurry vision. The vision can never be as sharp as someone of his age that does not have diabetes. There will be glare. Any oncoming ray of car will just easily dazzle that person. The person can even swerve off the road if the driver is not careful. So the driver will have reduced contrast sensitivity, and this makes night vision very, very dangerous. Don't you know that most of the accidents that happens, most of them are in the night now?
Yeah.
Many of those drivers' eyes, go and test it. Test their sugar level. All those things may be implicated though. So also, it can result in difficulty judging distances, reading road signs, or recognizing that a pedestrian is crossing the way, especially when it's at night or illumination is already reduced. And there could possibly, even during the day, be an increased risk of road traffic accident. But regular eye checks are very essential. Even when you are not renewing your driving license, you should have your eyes tested at least every year. As a driver that is over 40 years, you should have your eyes tested regularly. Not necessarily to change your glasses, but to be sure that your eyes are okay. You don't have to wait until 5 years that your driving license will expire before you go for eye check. No. And diabetic cataract, we can diagnose it only in the clinical. You cannot sit back at home and just look at somebody's eyes and say, there's diabetic cataract in your eye. No. It's when you come for an eye examination that we do comprehensive eye check. First, we'll detect that you have cataract, and then we'll do a differential diagnosis to know the type of cataract that you have. People that have diabetic cataract, their presentation of cataract, the type of cataract in their eye, is a bit different from people who have cataract who are not diabetic.
Okay. So
that's why you must do a comprehensive eye examination, and then we'll check your visual acuity, how well you can see what is far. Do a refraction, you can do a slit lamp biomicroscopy, and then in my clinic, it's a must. We do a dilated fundus eye examination for all first timers, whether you complain or you did not complain, whether you just can say, I want to just check for glasses. We have to educate you. Even before I came today, I had a patient in the clinic that, in fact, I had to be lecturing. I had to take my time to explain. This person already is a glasses wearer. He's been doing his eye tests in another clinic. But I don't know, it's like they didn't bother to explain, or they explained they didn't understand. As at the time we're checking his eyes, doing his tests, many of the bundles in the eye, macular bundles, were already affected. So please, the idea about eye health, eye care is prevention. It's not to cure. I can tell you the truth. Many of the eye diseases that we have, they don't have cure. It's treatment and management. But if we understand prevention, we will be better equipped to actually preserve the health of our eyes. And that's why I'm very, very passionate about disseminating information through this media, through several other forums that I have, to educate Lagosians, to educate Nigerians on the health of their eyes, that nobody should needlessly go blind. We should preserve our eyesight. Yes, preserve your eyesight. In fact, there's a patient I heard, recently, the brother uses our clinic. I said that, remember that my bro I referred to you, that the guy is now blind. He was diabetic, but he didn't know the diabetes was affecting his eyes until it was too late. So by the time he developed diabetic cataract, the cataract could not be taken off because the sugar level was too high.
Okay.
And if we want to do a surgical surgery for the patient, the sugar level must be normal, or at least to a stable level that the ophthalmologist feel he or she can do the surgery.
Okay.
Unfortunately, this man couldn't bring down his sugar level, and now I heard he's blind. My heart's bleeded for him. So please, we can prevent blindness from cataract. We can prevent blindness from diabetes. Diabetes is not a death sentence. I can. Do you also know that some people feel stigmatized by the fact that they are diabetic? They say no. In fact, they hide it. Please. And when you go for eye examination, they ask you to do tests. Please don't say what is test. In fact, somebody was asking me about tests. What are all these tests that you are writing for me? The eye clinic I was using before I came here, they didn't used to write all this kind of tests for me.
Imagine.
I said, that's where we are different. You have to do tests to understand what is happening. It's the tests that will help us to show,
to get a clear picture of what exactly is happening.
And then for best practices, you have to do tests. We have gone past that era where you just meet a doctor and say, doctor, my body is hot. The doctor will just use and touch your body and just prescribe. We don't do that. We have gone past that era. There's technology now actually to help us preserve and protect the health of our eyes. So for everyone, my listeners out there, whether you are diabetic or not, we need to understand what diabetic cataract is. Diabetic cataract is a preventable cause of vision impairment. Good metabolic control, early detection, and timely surgery can actually restore sight and improve the quality of life. But when you don't pay attention, or you feel that the money you want to use for eye test is a waste, or you feel that you are just doing your prayers, that one is okay. I'm not saying don't pray, but at the same time, make sure you are doing your medicals. Please, nobody should needlessly go blind from diabetic cataract or from any form of cataract at all, because all that we need to prevent that blindness is already available. It's already here. If only we can just come to the clinic on time. And fortunately, when you come on time, you spend less compared to when you come when a lot of damage has been done to the eye. More so, this era now, everybody is using digital devices
from adults
resulting in digital eye strain. I can have been doing surveys and doing researches on digital eye strain. Almost everybody has one form of strain on the eye as a result of the digital devices we are using every day. And this is resulting in what we call dry eye disease.
Well, what other choice do we have, really?
That's
if we look at it.
Yes, because you must use it. That's why you must protect your eyes. You have to protect your eyes. I'm not saying don't use your computer for the work you are doing. I'm not saying don't use your phone. But get sense, according to our local parlance. Get sense, because it is your eyes you are using on that phone, on that laptop at work, on that desktop in the office. It is the phone you are using to watch that home video. It is your eyes that is paying the price. So why can't you protect your eyes? So for patients who already are diabetes and they have diabetic retinopathy, they are more prone to digital eye strain. The more they focus on their digital devices, the more these rays of light, disturb the homeostasis of the eyes. And then fluctuating vision from unstable glucose levels reduce tear stability. Early lens changes causing visual discomfort on digital screens. Cataract adds to blur, glare, and eye fatigue during prolonged screen use. So both conditions can synergistically reduce visual comfort and performance. And these are the things we find every day. In my clinic, we have a package that we call the dry eye disease package. So we screen you for dry eyes. Yes, it's the tears that lubricate the eye.
Yes.
Somebody that is diabetic, the tears in the eye is already compromised. By the time you are now also looking at your digital display unit, it makes it worse. So somebody that is already prone to developing diabetic cataracts, and the person is using screen every day, it's making the condition worse. The screen may not be the cause of the disease, but it's going to worsen it. That's why someone, for example, in the city, a 40-year-old man in the city that works in a bank, and a 40-year-old man that lives in the village going to the farm, the state of their eyes are completely different. They are not the same. So please, let us make an effort to take proper care of our eyes. My duty is to educate you on the health of your eyes, is to create that awareness. It's my pleasure. I'm your avoidable blindness advocate. I also promote screen eye health. I don't want anybody to go blind. With all that is in me, by the grace of God, any fora I have, I always create that awareness. Because the Bible says my people perish for lack of knowledge. When you know, you should be able to do better. You know, some people spend billions on so many other things. But because they lack the awareness on how to take care of their eyes, they see the money they want to spend on their eye, on their heads as a waste. Meanwhile, when you die, you will leave the land. You will leave the car. All those things, your car become even obsolete.
Yes.
But your eyes are always with you. So why not invest in your eyes? So to everyone out there, please, the year is gradually coming to an end. Don't end this year without having a comprehensive eye examination. And my books are here.
Yes, of course, your books.
Yes, common eye symptoms.
Yes.
And of course, we'll talk about glaucoma, because glaucoma and diabetic cataract, they all work hand in hand.
All right. Dear listener, it's been a very rich show. Dr. Priscilla took us to the classrooms. Please, my plea to you is that you should not let diabetes cloud your world. So control your sugar, cherish your sight, and stay road ready. Don't wait for blurred vision. Schedule regular eye exams and stay proactive about your health status. If you missed any part of today's show or previous editions, you can always catch up via our Facebook page. That's Lagos Traffic Radio 96.1 FM, or you go to our YouTube channel, Traffic Radio 961. Search for the keywords Eyes on the Road. Dr. Priscilla Imade, OD, MSc, PhD in Public Health, is a consultant optometrist at the Modern Eye Care Foundation and a fellow of both the American Academy of Optometry and the Nigerian Optometrist Association. For inquiries, please visit plot 16 to 18 Ogunusi Road, opposite Omole Estate, Phase 1 by Akiode Bus Stop, Ojudibaraja, Lagos. Or call 080-3333 6672. That's 080-3333-6672. On behalf of the production team led by Micah Anrocha, with assistance from Adileke Tolualashe, our executive producer is Tayo Akonli. I am Akan Usen, saying eyes on the road, your safety, our priority. Lagos Traffic Radio 96.1 FM. See you next week.
To get this small food they're sharing, sometimes if